Chad Smith here for Juggernaut Training Systems. Today we're going to talk about working around injuries, alright, specifically in the squat. It's kind of tough to try and diagnose an injury over YouTube, so we're going to be talking in a lot of generalities today. We're going to talk about dealing with knee pain, hip pain, and lower back pain, and still being able to get some quality training done. Joined today by Dr. Quinn Hennock, and he's going to kind of talk about the physical therapist side of things, and I'm going to talk about some more practical, powerlifting side of things.
With knee pain, my job is to kind of help the athlete figure out how they can train. And so the session may be a big experimentation process where we focus on different positions, different variations of whatever lift they're working on as I work to address what I think is the cause of the issue. But there's almost always a way that you can modify a movement to get the necessary effect, or at least as close as possible. So when dealing with knee pain, what we want to address is we can manipulate the feet and we can manipulate the hip. The knee itself is a very simple joint for the most part. It hinges, it flexes, it extends. There is an element of rotation, but that's something that we're going to manipulate from the foot and the hip. And so with the knee, many times it's an issue of what's above and below, and so that's what we're going to focus on. So with the squat, let's say that your typical stance is wider than shoulder width and toes maybe toed out 45 degrees. So we're talking in generalities. What we're going to do is experiment with stance width, okay? So play with a more narrow stance, play with a wider stance with the same amount of toe in, toe out. Engage which stance recreates your symptoms or which stance makes them feel better. And in some cases, the stance that lessens your symptoms is not necessarily your sport-specific stance, but we've got to train in some capacity. And so it's okay to deviate from what you typically do if you can squat pain-free or with less symptoms. So you manipulate stance by going either wider or more narrow, and then you play with foot position. Toes forward, two toes out, maybe 45 degrees. And again, you experiment with what feels better. The knee is that simple joint, and it just needs to track naturally. So manipulating stance width and manipulating toe out is going to change the way that the knee tracks. And you will probably feel some positions that feel better than others. And it's as simple as the one with less or no symptoms is the way that you're going to try to recreate your barbell squat, at least for the time being. It's hard to start with the barbell, because the bar's on your back, you're tied up, it's heavier, so experimenting with these things can be difficult. So what I like to do is use a counterbalance squat. And so using like a plate or a kettlebell, it gives you a counterbalance so you're not going to fall on your ass, and you can play with different positions. And so let's say Chad's right knee is giving him some problems. He's going to go maybe a little more narrow than he's used to, and then he's going to hold the plate and just practice his squat. He's going to sit straight down. He's going to gauge how that feels. And then he's going to go a little wider than he typically would. Same thing, gauge how that feels. And then we'll play with different amounts of toe in, toe out within those squat variances, within the squat stance. Either more narrow with toes forward, more narrow with toes out, wider with toes forward, wider with toes out. What you will find is a position that's most comfortable for your knee, and that may dictate what variation of the squat you tend to train more. And we're going to talk about this a little bit more, but if a more narrow squat is something that feels more comfortable for the time being, then maybe that's we're using a safety bar, or we're using a front squat, or you've got to kind of gauge the exercise variation with the position of comfort. So it becomes this experimentation factor. One quick cue I want to talk about is the feet. Just make sure that you guys are actively pressing your big toe into the floor. So what I don't want to see is whatever width or toe out you're using, what I don't want to see is this toes coming up or pushing to the outside edge of your feet. You want to maintain these 3 points of contact, your big toe, your little toe, and your heel, and that will ensure that you have a stable platform and that your hips and your knees just kind of hinge naturally. And in some cases, that can take care of knee pain itself. Controlling the knees either forward or back is another thing to experiment with. Because I know it sounds counterintuitive, but sometimes driving your knees more forward than you're used to actually distributes the forces more evenly between the ankle, the knee, and the hip, and it actually makes people's knees feel better in some cases. So that's why I don't say, well, if you have knee pain, make sure you're sitting back with a vertical shin. With the counterbalance, you can experiment with driving your knees forward. You can experiment with sitting way back, and again, to find the position of most comfort. Now, if you're wearing a flatter soled shoe, that's gonna complement a more vertical tibia, butt back a little bit better, because it's just harder to drive your knees forward when you have a flat shoe. If you're wearing weightlifting shoes, that may exacerbate a knees forward squat, and maybe you have a tendency to come up off your heels anyway, and that's why you're getting the knee pain. So I like to experiment with this stuff, what we just talked about, barefoot to start, to give you a gauge. And then if you are a weightlifter or a powerlifter who wears a heels elevated shoe, then you just try to recreate the same position, but with the shoe that you typically train in.
So another useful workaround if you're dealing with knee pain in the squat is going to be box squatting. And I know you may have just gasped while watching this that I, Chad Wesley Smith, am suggesting that you box squat, right? And like I said, it's not going to be something I think is optimal training if you're healthy, all right? But if you're dealing with knee pain, the box squats could be a very useful tool for you. All right, there's really two ways to look at it. There's a box squat and there's a squat to a box. All right, so Dr. Quinn talked about manipulating your knee travel, and box squat, in more of the traditional west side type of sense, with keeping a totally vertical shin, the box is going to help you achieve that. So when I say box squat, that's more what I mean, is a little bit wider stance perhaps, really pushing the hips back, focusing on keeping that vertical shin position. So that's going to look a little bit more here. All right, we could also deal with more of like a squat to a box, and the distinction there would be that you're really just using the box as like a depth check. So this could end up being like a high squat, all right? But if that high squat is alleviating some of the symptoms of your knee pain, that's better than no squats. So that might be in your more normal, maybe a bit narrower stance. You're just going down, touch, and come up. All right, box is going to help make the reversal of the weight a little bit easier. And a lot of times that's going to be where the symptoms are flaring up the most, is right at the bottom of the squat when you need to change direction from down to up. Another good option there could be a reverse band squat, which is also going to alleviate stress in what is very often the most compromised position, the bottom of the squat, the most pressure on the knee. So now that we've talked about patella pain and some possible workarounds to that, now we want to talk about hip pain. So maybe a hip flexor strain.
A hip flexor strain can be many factors, right? It can be caused by the actual extension, and so in that case, like a sprinter obviously pulls back and strains that hip. In a squat, we're not getting that excessive hip extension, and so typically what people feel in their hip flexor during a squat is that impingement at the bottom. What we want to make sure that we restore, or at least get the most out of, is the ability to flex the hip and to rotate in either direction. And typically if you have a hip flexor strain, maybe you can flex straight up in this straight plane, but anytime you rotate the femur, that's when you get your symptoms. And unfortunately for a squat, you need that rotation, be it toe in, toe out, but also to sit in between your hips, to sit into a deep squat position, the femur has to rotate. And so that's what we want to restore. And a couple things, we can kind of build this one from the ground up, and the goal being to recruit the hamstrings, to recruit the abs, recruit the glutes, and to keep the hip flexors quiet for the time being. And this is where some of physical therapy exercises and corrective exercises can get scrutinized and criticized, because it's like, a clamshell, 3 sets of 10, is that really gonna work on a guy like this? And the idea is it's a neural thing. So we're sending more input to your glutes and hamstrings so that your brain feels that and senses that instead of the pain in your hip flexors. It's almost the same concept as if I jam my finger and I shake it really hard. It's just a different input to decrease the response. Neural drive to the muscles that we want the athlete to feel, and away from the muscles that are strained, so we can just facilitate their healing. And that's where the glute activation stuff comes in really handy. So we'll go right into that. So I had mentioned in the beginning, restoring the ability for the athlete to be able to flex the hip and also rotate. And with that rotation, internal hip rotation is actually paramount to be able to sit deeply into a squat. It seems counterintuitive because that resembles a knock-kneed squat, but to actually be able to sit in between your feet without discomfort, we need that hip to be able to internally rotate. So we're mimicking a squatting pattern, all right, and hopefully at this point, he's not super activated in his hip flexors, he's not having any symptoms there. What I'm gonna have to do is breathe in and exhale all the way. So Chad's gonna squeeze the roller here, and then he's gonna bring his feet out to the side. And this is where you gotta be, as an athlete, you gotta have to be careful because you don't wanna jam your hip into that impingement and recreate your symptoms. But what we're trying to do is get that hip to be able to rotate and flex in the socket. And so Chad's gonna pull down on the bench, getting his hamstrings to turn on and lift his tailbone just slightly. And that's gonna, again, create a little bit more space in his hip. And from here, he's just gonna exhale hard and brace. And what I like to do is press this plate up to the ceiling as you exhale, and that's just gonna facilitate abs. So what did we say in the beginning? I wanna recruit abs, I wanna recruit hamstrings, and we'll recruit glutes here in a minute, but all the while trying to keep that muscle quiet. And so if you have a strain in that area, really try to relax the front of your hip and get the activation from the hamstrings, get it from the abs. So 5 full breaths here and relax. So, and then I'll get another question of, what about soft tissue stuff, foam rollers or cross balls? Those things are great. What I would suggest is you use them in between sets. So if you have some discomfort here, you take a lacrosse ball, you dig it in your TFL area here, 20, 30 seconds just to knock down any of that perceived tightness, and then you hit this drill. What you'll find is you'll be able to go into more internal rotation and flexion with less and less symptoms. And so the lacrosse ball and the foam roller, they're tools, they're short-term tools to give you a window of opportunity. It's not, well, now I got a foam roll for 30 minutes to take care of my hip strain. I really like to alternate them back and forth with some type of drill. We'll put Chad on his side, so in this kind of clamshell sideline position. This would be best against a wall. So just imagine that, the front of this bench is a plane, it's a wall. The clamshell drill, you see this a lot, and you see it done incorrectly. They're just laying, 3 sets of 10 clamshells, and maybe it gets their glute to fire, maybe it doesn't. But the goal is not to just get the glute to fire, but the goal is to control a squat pattern. So I'm gonna take this out from underneath you. And this is how I teach a clamshell. So I'm gonna have Chad roll forward with his knee and then push this knee up here and then hold, okay? You can have a band, but just gravity alone, when you're actively in this position, you have to control here. Relax the front of the hip, try to just push either against gravity or against a band or against my pressure, and you should start to feel some of this light up. And then that to your brain is, okay, your brain is sensing glute, it's getting input from glute, it's not getting input from the injured hip flexor, that's what we want. Okay, small reps up and down, just like that. Again, recreating maybe 5 full breaths, 10 reps to failure. So that's how I would incorporate that position. But you notice it looks like a squat. Okay, we're reinforcing the squatting pattern. So we move to the quadruped position. If you'll notice, we start in a position of most stability. So supine, we go to sideline, we move up to quadruped. We're just building up to a squatting pattern, to a standing pattern. Understand that this takes no time. I mean, move through this sequence in a matter of minutes. But we're now mimicking a squat even more so because Chad can kind of rock back and forth and it resembles a squat. So if he can manipulate the angle here of the hip, so if he rocks back more, that's going to put him obviously into a deeper squat, but may increase his hip flexor symptoms. So he can rock out of that, or he can bring the leg further back so he's a little bit offset, just to take some pressure. But the activation drill is the same that we were on our side. So he shifts over to his right side and then just holds this position against the resistance of the band. And he can move this foot again, he can move it further back to clear some space in the hip to give that a break, and then he can slowly begin to work his way back up to a deeper position, but we're trying to drive the recruitment here, trying to quiet that hip flexor. And if he feels it here in the front, 20, 30 seconds lacrosse ball, then retest, do the same drill. You can rock, do that, back shift over to your right, lift that, and then we can rock back and forth, trying to get into that hip a little bit, but we're pushing against the band, right, and getting that drive to the glute. You don't have to push excessively out, you're just trying to resist the band pulling in, okay? From there, we can go to standing. We know for a fact that the more anterior tilt of the pelvis, the less flexion and hip internal rotation mobility you have, period. That's a fact. It's just biomechanics. But we also know that we don't we can't squat heavy weights with a poop dog pelvis, okay? So we've got to, this is where the counterbalance comes in handy again, because you can experiment with how much arch and tilt that you're able to squat in without feeling those hip flexor symptoms. So I give it to Chad, and first I'm going to cue him to really arch his lower back hard and anterior tilt, really dump his pelvis forward. And I'll have him squat. Many times I'll say, okay, maybe that flares up my symptoms a little bit. Then I'll have them do the opposite. So bend your knees a little bit and really tuck your tailbone, posterior tilt. You're almost in flexion here. And then squat. They're going to say, typically that feels better, but that's not the position of the spine that we necessarily want to load. And then this is where the experimentation comes into play. So you play with, I can't be overextended because it hurts my hip, but I don't want to be super flexed. Find a middle ground and then try to maintain that middle ground as you squat down. The counterbalance is a great cue for that. At the same time, the band is offering some cueing to the glutes that you get, all the while hopefully the hip flexors is turned off at that point. So that's the way I would build somebody up who's got a hip flexor strain.
The next area of pain that we want to talk about is going to be low back pain. This is something that I dealt with myself with 2 herniated discs back in June 2013, and Dr. Quinn was integral in my rehab for that, and it really helped me work around that pain and get back to, not just as strong as I was before, but stronger than I had ever been.
The back, probably the most complicated of many injuries that you can have, just because there's many causes and there's some fear avoidance with that. You get back pain or some herniated discs like Chad had, and there's some question, will I ever get back? And many times you can. You just have to be smart. And as simple as that sounds, you can't continuously jam into the positions that are causing you the symptoms, because that's just going to create this vicious cycle in your head that every time I do this movement, I associate it with pain. And so the first thing that I look at when somebody comes to me with back pain that we need to continue training is what position of the spine causes the symptoms and which is the position of comfort. In the beginning, it's flexion versus extension. And so I'll have the athlete do a toe touch. So I want their lower back to comfortably round, or as best they can. And they're going to bend forward as far as they can comfortably, allow themselves to flex. I want to see how apprehensive they are to flexion and come back up.
The day that my injury first occurred, I was dealing with about this much flexion before pain happened.
If that position is apprehensive, or they don't like to let their back flex, or they are very just decreased here, hitting a deep squat may be problematic, because a squat is as much as we need to stay upright and erect, a squat is a flexion-based pattern, meaning that if at the bottom, if something is going to go awry, it's going to be a flexion moment. And so if the athlete is already sensitive to that, deep squatting may be problematic. And so that's where we talk about the box squat or the squat to box, modulating the depth. A rack squat, where we're going down and we're hitting the pins, as low as we can go without pain, but keeping that spine in certainly not flexed. We don't want to be overextended, but in that middle range extension position where we're comfortable, and squatting to there and then driving up. Now, if flexion is the position of comfort, and then the next thing I'll test is spinal extension. So I'll have you, a couple things, go over your head with your arms. So sometimes this recreates the person's symptoms, and it's that overextended kind of compressive force through the lower back, through the pelvis, and I may even go hands on hips and do the same thing. It's a little bit more sensitive to the lower lumbar and the SI joint region, but sometimes that recreates their exact symptoms. Oh, it feels pinchy back there, I don't like that. And so in that case, cueing that athlete in a hard arch is probably going to exacerbate their symptoms. So maybe they will benefit more from a high bar squat versus a low bar squat, because a low bar is inherently going to put you more torso forward, more arch, more compressive force. A high bar squat, your hips underneath you, and you're a little bit more stacked. Front squat, even more so. They may like a front squat over a back squat, because in a front squat, you can't really stick your ass back and overextend because you're going to dump the weight forward. And so just respect the directional preference and then set your position and pattern up from there. Again, I love the quadruped position because it mimics the squat so well, but with the ground support, it's just a really nice teaching tool. And so I'll do the same test. I'll have them flex. So this is like kind of cat camel, cat cow, very common exercise that you'll see. So flex all the way, the other way. So Again, if this creates their symptoms, then we're going to try to move towards a more braced, extended position. Now I'll have you go all the way into extension. If this position recreates their back symptoms, then I'm going to take them out of hyperextension, but really the fix is pretty much the same. Find a middle ground. So if it's here for Chad and that feels okay with his spine, I'm literally going to have him rock back and forth, trying not to move through his lower back, and his pelvis. So we can put a PVC there. He's got those points of contact. But what I don't want is overextension, him just dumping force, or a super flex position if that's what causes his symptoms. So this neutral position, rocking back and forth, so he can hold that. He can bring his hands a little bit closer to his knees, but still having to hold that position, and you'll find that all of a sudden you have to reflexively stabilize your abs. I can have him lift a hand up and hold, and I can give him little pushes. If you've got like a lifting partner, it could do this for you, but all the while you're stabilizing the spinal position that doesn't cause you pain. And now you've felt it, so you should be able to recreate this on your feet or be better able. So Chad goes back onto his feet, and I can say, you remember that position that we had you in quadruped? You weren't overextended, you weren't super flexed. Try to recreate that now when you squat. And guess what? A counterbalance is really helpful here to teach that position. And he's probably much more upright than he normally would be, especially for a low bar back squat, but that's the point. You know, we're working around the injury and eventually becoming more specific as we heal and as we build resiliency in those positions.
For me, as I rehabbed my back injury, the quadruped drills, the 90-90 breathing drills, those were critical. But as I actually looked at getting back into lifting, all right, into squatting, the thing that I wanted to get back to doing, you know, it started out with very, very low intensity. You know, it was about 2 weeks after the initial injury where I could actually do a bodyweight squat to competition depth. All right, and that's all I could do with no load. So I did that with extremely high frequency. I would do 50 bodyweight squats in the morning, 50 in the afternoon, 50 at night, 7 days a week. I did that for 2 or 3 weeks. Then I added a goblet squat, so the counterbalance with the kettlebell in front. I was doing that twice a day as the intensity increased a little bit. All right, did that for 2 or 3 weeks. Then I went to high bar back squatting and front squatting with a very vertical torso position, and I was squatting 6 days a week like that. All right, so as the intensity increased, I had to cut down that frequency and volume, but I was getting more stimulus from every session, and then, you know, just continually cut down volume until I was back into relatively normal training, you know, squatting 400 plus pounds per session, and that was probably about 3 to 4 months after my initial injury. And I was very deliberate in taking my time because I wanted to be as thorough as possible in the rehab. Whether it's front squats that alleviate the back pain for you, high bar back squats, belt squats with the weight hanging between your legs, a handle squat, you know, or even machines, you know, leg press, hack squat, that kind of thing. If those allow you to train in a pain-free environment, that's what you need to do to work around the injury. You know, that even though some of those might not be optimal exercises for optimal training when you're healthy, you don't get to do optimal training because you're not healthy. So please take this advice from Dr. Quinn and myself to heart. You know, injuries are very frustrating, but be patient, get whatever you can done. All right, and remember that even, you know, having to take a step back for a week, 2 weeks, a month, 3 months, whatever it is really nothing in the grand scheme of your training and your career. So thanks for watching. Hopefully you learned something. Make sure you subscribe to the channel.